Welcome to Novice Cataract Skills presented by myself, Barton Blackerby. In these videos I show you some tips that will improve your cataract skills as well as to identify and correct mistakes that a novice cataract surgeon such as myself will make. Today we'll be focusing on how to utilize both hands during cataract surgery. When making your main wound, use your second hand to help stabilize the globe. In this video I use a Thornton ring to accomplish this task. Notice that by stabilizing the globe, the creation of my triplanar wound is made easier. You can also use your second hand to add stability during maneuvers that require it. As seen here, I utilize my second hand to add stability to the cannula. This allows me to confidently place my cannula tip under the capsule and in the periphery without fear of inadvertently moving my hand and causing a tear. Lens not behaving? Use your second hand to manipulate the lens with a Drysdale or a Connor wand. These instruments can phaco fine-tuned movement that the phaco tip cannot. There is added safety benefit in that your phaco tip is not in the periphery of the lens where an accidental engagement of phaco power would be problematic. Unless you plan to bowl the lens out, your second instrument will be essential for proper cracking of the lens. By placing both the phaco tip and the second instrument towards the periphery and deep into the groove, the lens will crack nicely. If not, you may need to deepen or lengthen your grooves. If it will still not crack, make sure you didn't leave the center of your grooves too thick. This happens quite frequently if you're burrowing while using the phaco and leaves an island of lens right in the middle of your groove, which will not allow the lens to crack. That second instrument can also be utilized to manipulate the lens quadrants. Instead of chasing pieces with the phaco tip, it is better to keep the tip in the center as much as possible and bring pieces to it. Once your phaco tip is occluded, use the second instrument to protect the posterior capsule. By keeping your second instrument beyond and behind the phaco tip, you can minimize the chance that the bag is punctured during quadrant removal. Make sure you keep enough distance. I had an occasion where my second instrument was beyond and behind but still too close to the phaco tip. Once the quadrant was removed, the bag wrapped around my second instrument and into the phaco. I then had the educational opportunity to perform an anterior vitrectomy. Finally, your second hand can be used to assist in difficult steps such as lens insertion. When inserting the lens cartridge, the eye can become deformed or roll away from you. When this happens, extra strain is placed on the cornea and your anterior chamber collapses as your viscoelastic is burnt from your wounds. If you keep trying to push it, it will just become more difficult. You can avoid this by using a second instrument such as a .12 or a CTA to stabilize the globe and allow enough counter traction that the eye does not move and the lens cartridge is inserted. So remember, you have two hands for a reason, and utilizing both will help you out tremendously during the case. Thanks for watching, and I hope that some of these tips presented here help you, or at least help you identify solutions or problems you may be having during your early cataract career.